Andrew Wakefield was a guy who has been more than discredited.
The whole pitch is,
Nothing in science is absolute. It is all probabilistic.
are there alternatives?
Paxlovid was a drug that was approved to treat people with COVID.
Everybody that has kids, is wondering,
What's going to happen when it reaches 1 million people?
that's great.
And this guy was the worst example of bad science. I'll give you one example. It's a controversial example, but I feel strongly about it. Paxlovid was a drug that was approved to treat people with COVID, right? This was a drug, I believe it's a Pfizer drug. So if you got COVID, they would give you Paxlovid. And it was approved very quickly. But I think ask any doctor who's been prescribing Paxlovid for patients with COVID, the drug doesn't work. Like, it just outright doesn't work. And by the way, it might even increase your risk of getting subsequent COVID. And while I can appreciate why the FDA wanted to see that drug approved quickly, because of the way the world looked then, and especially if you're trying to treat people who are uniquely vulnerable to COVID, which would primarily be older people, I think where a lot of trust was lost in that it would have been great if they did follow-up studies that 6 months later said, hey, this drug's been in the world today for 6 months. It's not working. We should pull the drug. Because a lot of money is getting wasted. And frankly, a lot of people are being put on a drug. It's not harmful, but it's not helpful. Right? So why would we have a non-helpful drug out there? So again, I know that that's a bit of a long answer, but I hope that I'm communicating the nuance of the situation, which is it's not black and white.
Thank you for sure. Then I'm curious too, vaccines, all these things are popping in my head that aren't in the outline. Vaccines are a major topic of discussion in a lot of homes right now. Everybody that has kids, is wondering, me included, should we vaccinate our kids? Should we not? What do we do? And me and my wife have kind of set off on this journey, interviewing a lot of different medical professionals, and it gets hard. It gets for somebody that's not a medical professional myself. It's what I find is we'll go to a practice and it feels like it's a sales pitch. It's a sales pitch on, we don't vaccinate, we're anti-vax, you don't have to vaccinate your kids here. And it's like, that's great. But we still need a healthcare professional. We don't just need somebody to tell us, hey, don't vaccinate your kids at all. Like, what if my kid gets a broken arm? What are you going to treat him with? And it becomes like this sales pitch. The whole pitch is, we don't vax, which, like I said, great, you don't vax, but what do you do here? And other than tell me that vaccinations are horrible for my kids and for myself and my wife. And so I'm just curious what your thoughts are on vaccinations. If you have any, what should we be doing? What should we not be doing?
Well, this is a topic I've put more work into than I wish. I say that because it's not something I'm really interested in, to be honest with you. I don't, there are lots of things I'm interested in. This is not on the list, right? But I've had to put a lot of interest into it. I've had to put a lot of time into it. I suppose because of the position that I have found myself in, where people are saying, hey, Peter, you're a very, very public-facing physician, and you're not in the quack category. Like, there are lots of quack physicians out there, but like, we want to hear what you have to say. I also have a personal interest in it because I have 3 kids. So what have I learned? Well, I've learned that there are certain, so first of all, this is another topic that is not going to be a popular topic because people don't love gray. They want black and they want white. Nothing in science is absolute. It is all probabilistic. So there are very, very, very high probabilistic certainties, and there are very, very, very low probabilistic certainties. So for example, I know that if you have a certain type of infection and I give you this type of antibiotic, the probability that it will cure that infection and save your life is exceedingly high. It's 99%. But I can't say with 100% certainty that every single person that has this infection to whom I give this antibiotic will be cured. Can't say that. That's not how biology works, and biology is the messiest of the sciences. So with that stated, I think there are some high probability certainties out there with respect to vaccine. I think there are some really gray areas. And I think everybody needs to ask the question, what am I optimizing for? So I will start that question with you, right? What is it you are most afraid of as you think about vaccinating your kids? What is the mistake you're worried about? What are you afraid of? And what are you hoping to achieve?
Well, I think something that I'm afraid of, is, there's a lot of talk, and maybe it's rhetoric, maybe it's not, about autism, being caused by vaccines. Well, me and my wife talk about this all the time, and there's all the people out there that are, my kid took the MMR shot, hasn't been the same since. And and then there's the studies with the rise in autism, but are we testing more effectively for autism? Is there's got to be some sort of a scale, like how
Yep.
autistic are you? Are we diagnosing more, based off of that scale, because more and more symptoms or whatever are becoming more prevalent? And so is that the reason that autism is on the rise? Is it's just we didn't diagnose as many people because the symptoms were not is is prevalent, or is there actually a rise? And so that's one thing. Then there's all the the COVID stuff about the COVID vaccine. Is it giving people, is it creating heart problems? Are people dying from the vaccine? I don't know. You know what I mean? I don't know what to think.
So well, let's just take those two examples. I think the second one's a lot easier because I think the answer there is I would put it a little more in the more certainty category. Although I think the previous one as well we can address. So when it comes to the COVID vaccine, one of the concerns, particularly with the mRNA vaccines, and particularly more so with the Moderna one than the Pfizer one, was you saw an above the baseline increase in myocarditis, in particular in young men. So myocarditis is an inflammation of the cardiac muscle. Now, you always have to remember when you're vaccinating millions of people, there's going to be background noise. People get myocarditis all the time. And you can get any sort of viral infection and get myocarditis. I've known countless people and seen in the hospital and been around people who have got myocarditis for no reason other than they got an infection. So you have to know there's a baseline level of this going on. But it really appeared that in particular for young men, teenagers and in their 20s perhaps, there was an uptick following that particular vaccine in the incidence of myocarditis. To be clear, most of those men recovered without event. I think that the real mistake of policymakers at the time, because this would have been about 2022, was not acknowledging that, right? Like, to acknowledge that is basically to say, hey, this is biomedical science. Things happen, and we don't always know when we do studies on a few thousand people what's going to happen when it reaches 1 million people. Because if the signal is so small that it's only 0.1% of people, you're not going to pick that up at 1,000. You got to be able to do 1 million, and you're not going to do that until it's out in the real world. So why not just acknowledge that and say, hey, that's a risk we should be aware of, and we should weigh that risk against the benefit. Because what's the harm to an 18-year-old healthy male when he gets COVID? Well, we can quantify that. We know what that risk is. We've seen enough variants of COVID to know that. Is that risk worth that trade-off? And I think reasonable people, when presented with that set of facts, can make their own decision. I know my decision for my kids in that setting when confronted with that information. And it might not be the same as the next person, but that's okay. I think we just want people to be able to make reasonable decisions based on reasonable information. But when it turned into, there's nothing wrong with it, the sort of denying it, I think that cost a lot of credibility. And when parents got demonized for asking the question, and saying, hey, should my 6-year-old who's completely healthy really get this vaccine? And they got turned into bad people for that. I think that was a huge mistake. Mm-hmm. And again, I can tell you, taking care of countless people, I have patients that ran the spectrum across there. I had patients that said, I want me and my family to get every single vaccine there is. And I had other people that said, we're not touching this thing with a 10-foot pole. And my job was not to talk anybody into or out of anything. It was simply to make sure they understand and can quantify the risk of both decisions and to be there and help them think through it. And that's it. So I hope that answers your question on the myocarditis. Yes, there was indeed a real signal. In absolute terms, it wasn't big, but in my opinion, it was not worth the risk to young males. That's my personal opinion. I don't think it was worth the risk. And that means, as such, I did not vaccinate my kids because they were otherwise healthy. I also feel very fortunate that we live in a state where it was not mandated, and therefore we didn't actually have to pay a heavy price for it. So I also have empathy for people who live in draconian states where these things were shoved down their throat. But, when you live in a great state like Texas, they tend to defer to what the parents think is right, at least in this regard around a COVID vaccine. And we just felt like, hey, it wasn't necessary. Our kids are super young and healthy. Why put anything else into them that they don't need? That said, I take a different point of view on other vaccines. I think there are a number of vaccines where the risk of not vaccinating them is so much worse than the risk of vaccinating them. The one in particular that I have looked into more than all others combined is indeed MMR, because I think every parent who has been, and I say this word deliberately, misled by the fraud that came out of a guy by the name of Andrew Wakefield, will always have in the back of their mind the lingering concern about autism. So Andrew Wakefield was a guy who has been more than discredited. So I say this again with complete clarity. He has been more than discredited for what he did to completely and deliberately and fraudulently manipulate data to make a case that the MMR vaccine caused COVID. I've done
autism?
Caused autism. I've done a complete podcast on this, so if people are interested, I interviewed the journalist who's done great work on this, and we kind of go through all the work. His name is Brian Deere, not a pro-vaccine guy, by the way, doesn't care about vaccines one bit, despite the fact that people have tried to make him the face of MMR. He's like, nope, I just care about science, and this guy was the worst example of bad science. So I can tell you with a very high degree of confidence, without wasting the next 3 hours, why the MMR vaccine is safe. And furthermore, why I think kids who don't get the MMR vaccine are really at risk of getting diseases that are much, much too significant to ignore. An area where sorry, you're going to ask a question and I'll go to another direction.
I don't want to take you off your train of thought, so go ahead.
I was just going to say, now let's talk about an area that I would put in the middle, because right there I'm saying on the one hand, again, I didn't think the COVID vaccine made sense for young, healthy kids. I really do think the MMR vaccine absolutely makes sense for all kids. So here's an area where I think the system has kind of broken a little bit, and it's the use of the Hep B vaccine for kids early in life. So today, if a child is born in the United States, they are going to want to give them their first of their hepatitis B shots while they're in the hospital. Now, that has never made sense to me biologically, because unless the mother has Hep B, in which case that makes sense, because the risk of transmission is very high. And to be clear, Hep B is an awful disease. So I'm not minimizing Hep B at all. We have no treatment for it. We have no cure for it. If you have hepatitis B, the risk of getting cirrhosis and needing a liver transplant, or the risk of or getting what's called hepatocellular cancer, is very high. So you don't want Hep B, but it's a bloodborne transmitted disease. Like, you're not going to catch it in the air. So if a child is born to a mom that doesn't have Hep B, the risk that that kid's going to get Hep B in the first 5 years of their life is virtually zero. And for that reason, I don't see the need to subject them to that vaccine immediately. But I also understand where the medical community is coming from, which is saying, hey, we don't want to miss an opportunity to give a vaccine, because if we don't give it now, this kid might never get it. So So there's a policy decision that needs to be made by people there. Personally, if it were me, I'd like to see it studied. This is where I actually would like to see the NIH fund an experiment because I'm genuinely curious. Is it safe to give children that many vaccines that early in life? Or should we limit them to the ones that are absolutely essential, where we know, hey, measles, mumps, rubella, smallpox, polio, these are devastating diseases. And especially if you have a kid that's going to go to daycare where they're going to be around a lot of kids and the risk of transmission if there's an outbreak is non-trivial. So again, we want to eradicate smallpox and polio. MMR probably don't get eradicated, but we want to protect kids against them. And Hep B strikes me as something like, I don't think we need to do that right away, but I'd like to see it studied. So that's kind of three extreme examples of how to think about this. But as you can tell, given that it just took me 10 minutes to explain those three things at a superficial level, nobody wants to have this discussion. They just want to be black or white. Are you pro-vax or you anti-vax?
No matter where you're watching Sean Ryan Show from, if you get anything out of this, please like, comment, subscribe, and most importantly, share this everywhere you possibly can. And if you're feeling extra generous, please leave us a review on Apple and Spotify podcasts.